Around 20% of adult Americans suffer from a sleep disorder, with sleep apnea being the most common. Sleep apnea is when you stop breathing while asleep. Sometimes it wakes you up, other times it just disrupts how deep you're sleeping. In any case, it's a very serious problem that often gets neglected until your bedmate needs to change their sleeping habits because of your snoring. Now, not all snoring causes sleep apnea, but all snoring should be evaluated, as there could be scary complications. Hi, my name is Dr. Daniel Davids. I'm a physical therapist and I run the Traveling Physical Therapist. We provide Medicare-covered in-home physical and occupational therapy throughout Long Island. We're losing sleep at night thinking about how many people in our community we could be helping out. That's why we put together this video series to help the community that we love so much. This video is titled Essential Facts About Snoring and How to Stop It. Nearly half of all adults snore, at least occasionally. Now, snoring is most common among men, seniors, and people who are overweight. Here are some basic facts about snoring, how it can affect your life, and how to cope with it. Monitor your sleep quality. If you live alone, it may be difficult to know for sure if you snore. One easy warning sign of snoring is waking up in the morning feeling tired, even after a full night's sleep. Now, your snoring may actually be waking you up continually through the night and interfering with the quality of your sleep. You want to manage the risk of cardiovascular issues. Doctors have reported that obstructive sleep apnea places a heavy strain on the heart. More recent studies suggest that even less severe snoring could increase the risk for heart disease. Early treatment is important to catch increases in blood pressure and other changes promptly. Know the causes for your snoring. Different kinds of snoring require different treatments. Talk with your doctor if you suspect a medical condition such as enlarged tonsils or respiratory infections. Otherwise, lifestyle changes may be all that's needed. Now, here are some easy and effective remedies that don't require drugs and do not require surgery. The first one, simple, get more sleep. Try getting an extra hour or two of sleep each night. When you're overtired, your throat and tongue muscles may loosen and block your airways. This is similar to the effects of aging, but in this case, you could do something about it. The next thing is to sleep on your side. Some people get instant snoring relief just by sleeping on their side rather than their back. Now, it definitely takes some practice to change old habits, but you could train yourself to do it. Putting a pillow alongside your body will help to hold you in place on your side. The next one would be to elevate your head at night. If you're free from neck problems, you may want to experiment with holding your head higher at night, as in an extra pillow or two. You can get in bed, a bed that adjusts to an incline, or use an extra pillow to prop yourself up. Avoid sedatives, alcohol, and late night eating. Anyone may be vulnerable to snoring after drinking, eating, or taking certain medications before bed. Consume your last cocktail or meal at least 4 hours before you go to sleep. Lose weight. That's right. Excess weight around the throat also makes it harder to breathe correctly, especially at night when you're lying down. If you notice that your snoring started only after you put on a few pounds, well, it may be time for a diet and a little more exercise. Treat nasal congestion. Steam opens up your nasal passages. Why not try a hot shower before bed or a vaporizer while you're asleep? Nasal strips and gargling with salt water may also help out a lot. Reduce household dust. Getting household dust under control will help you breathe better night and day. Shop for anti-allergy bedding and replace your pillow regularly. Finally, ask your doctor about non-surgical treatment. If your snoring persists, there are several medical appliances that your doctor can recommend. For example, a CPAP, or continuous positive airway pressure therapy, is when you use a breathing device to pump air into your airways, keeping them open. It's often the primary treatment for sleep apnea. Home remedies and other proper medical treatment can often reduce the incidence and intensity of snoring, as well as minimize the negative effects. Get help with snoring so you, and anyone in earshot, can start enjoying a good night's sleep. Hey, do you want to prevent your next fall? Do you want to maximize your quality of life? Do you want to move as confidently and pain-free as you did 25 years ago? Of course you do. Who wouldn't? We are the Traveling Physical Therapist, and we provide Medicare-covered physical and occupational therapy in your community, and for most, it will cost you exactly $0 out of pocket. We want you to come check us out so you can get back to doing the things that are important, like going to the park with your grandchildren, or hanging out with your girlfriends, or just enjoying a happy and healthy life just like you used to. So come visit us at www.thetravelingpt.com. And when you do, we're going to send you a free gift, our very popular book, That Really Helpful Book on Fall Prevention. All you have to do is go to our page, click on Contact Us, and drop me a note. And I will personally make sure that this book ends up in your hands at absolutely no cost. www.thetravelingpt.com for a Medicare-covered boost of confidence, quality of life, delivered right in your living room.